This is the C-Section Experience podcast, where we support you in preparing for and processing your C-section journey through education, validation, and storytelling. We're here to reduce anxiety, amplify your voice, and help you feel truly seen. I'm Dr. Jen, an obstetric anesthesiologist.
And I'm Bethany, a nurse and a birth educator. As friends and fellow C-section mamas, we're on a mission to empower you. Through personal stories and expert guests, we'll laugh, we'll cry, feel all the feels, so you can approach your birth with confidence. Are you ready? Hi, Jen.
Hi, Bethany.
How are you today?
Good. Okay.
You're good. You're okay. All right. I think our topic today is a little
Yeah.
and frustrating.
It's frustrating.
Let's say what it is, Jen.
We're going to talk about
Drum
Tylenol,
roll.
which has certainly been all over my social media feeds recently. I know all of our feeds look different,
Right.
but I have thoughts, of course, and have been marinating on it and hearing what other people have been saying. So I just thought it's a good time to have this conversation. I think it's relevant to all pregnant women, but particularly those who are going in to have surgery and need options for pain control, and how this extends potentially into just a lot of fear surrounding Tylenol for various reasons. So obviously we're talking about this because there was a grand announcement that President Trump, what he said, I think in his press conference, I guess.
Okay, wait, can I just pause you? Did you watch it?
I just saw clips of it.
Same. I was just like, I don't know.
Yeah. And there's shorter clips and longer. I watched a longer clip of it, which was, I think, most of it.
Right.
Essentially just saying that, actually I did write down. It's hard because like his speech is not incredibly clear always. But so how he started, after he was able to pronounce acetaminophen, he said,
There's a good starting point.
Yeah, I was just like, oh, this is perfect. He used the phrase, can be associated with a very increased risk of autism. So taking Tylenol is not good. I'll say it's not good. But then he goes on to qualify that for cases of extremely high fever, if you can't tough it out, if you can't do it, you can take it, but I don't think you should. Don't take it. Okay.
Right.
So very confusing.
Yeah. And also, too, the fact that he's like basically, I feel like he didn't come out and say it, but he's basically saying to women, you should be able to handle pain and not have to take a pill. Did you read into it that way?
Well, I think all of this it's an attack on a lot of things, on science and medicine and women.
Totally.
Right? A lot of these are the things that affect our children, things that affect pregnancy. I mean, there was a whole thing on SSRIs, like they're taking a deeper look at SSRIs in pregnancy and bringing more shame and guilt around that as well for women who have mental health conditions that they're needing to treat during pregnancy, and just piling on the shame and the guilt is really, it's hard to understand the motivations behind any of this.
Right. Foundation of medicine is risk versus benefit.
Right.
It's founded on scientific data. That's why there's so much money that is put into research. So when you just say a very blanket statement without having more scientific data to support that, then what is that statement really? It's just a statement.
It's just a statement. And it wasn't really anything new. So he said what he said. And then if you actually look at what's written on the HHS website, it's also written in just a way that is very purposefully unclear.
Yeah.
And they do add in the qualifications to everything, saying, but we understand that the data is conflicting. We understand that there's a study, which I do want to talk about, that is one of the biggest and best studies, and it came out recently, that it's disproving this link, this association between Tylenol and autism. And then ultimately saying, well, doctors should make a choice, which is, this is already what was happening, and women should only take this medication at the lowest doses for the shortest amount of time, which is literally what we always have said about any medication. That is the advice that has always been given, no matter what medication you're talking about. Making a clinical decision based on your own situation and your own risk factors. What is the reason that you're taking this medication? People don't take antidepressants who don't need antidepressants, and people don't take Tylenol who don't have fever, infection, pain, whatever it is. Unlike, let's say, opioids or alcohol or maybe other exposures, potential exposures during pregnancy, not necessarily treating something, with opioids being addictive. It's just so opposite of where we should be going.
That's how I felt too. I'm like, we have worked so hard to get where we are, and now we're just backpedaling.
Yeah. For so long, there were so many things that got missed during pregnancy that weren't properly treated during pregnancy, because the easiest thing to say is, well, do nothing. Don't get that x-ray. Don't take that medication. You're pregnant. You can't. Just do nothing. And then we realize over time that this is not the best way to treat things. And if you really look at the risks, they're much less than we really thought that they were previously. And we're saying, actually, it is okay. If you really need XYZ medication, the risks are not that high, of course, with a risk-benefit discussion with the mom, and this is a personal choice. But withholding treatment to pregnant patients is not the answer. It's what we are fighting against. And this is now taking a medication which has been the medication that has not been shown to be causing any birth defects, creating any potential problems during pregnancy, and now saying, well, this one too actually, and we're using autism because it's such a complicated condition, and it's so, it really hits the moms because we're talking about your children, and it's such a spectrum.
I was just going to say that too.
It's such a spectrum, and there's arguments of, are these neurodivergences, are they really even disease, or are they to some extent differences in people? Because they're also lumping ADHD in with this. It's just very broad and vague. Comes down to fear mongering, which makes me so sad because, again, what are we trying to do? Is reduce fear.
Reduce fear. And actually, too, it takes me back to, I would have some patients that would be calling so freaked out. They're like, oh my God, I had a turkey sandwich. And they would be beating themselves up about eating a turkey sandwich. They're like, I don't know, I ate it. I was really hungry. And then I thought about it. And I'm like, wait, I probably shouldn't have taken that. Like, what should I do now? I for sure have harmed my baby. And I'm like, this stress, this unnecessary stress that we put on ourselves already as women when we're in our conceiving years and we're pregnant, that like you're trying to do everything to sustain a healthy pregnancy. So as soon as something comes into your psyche, it's like, sometimes I could not talk a woman off the ledge. She was like, I have to come in. I'm like, okay.
And what does that stress do to your body?
And that's the thing. That's the bigger thing, is that heightened stress and that worry that's more toxic to your body than processing real scientific data, understanding it, thinking about it in a rational way, versus once you have that fear factor, you almost can't think in a rational manner. Right. And that is troubling.
Right. So just layering on one more thing that really has not been shown in scientific data, it's just really, really, really infuriating.
It sure is. Wait, can I read a quote from Dr. Stephen Fleischman, who is the president of ACOG?
Sure.
So he immediately spoke up after this information was put out there. And he said, suggestions that acetaminophen use in pregnancy causes autism are not only highly concerning to clinicians, but also irresponsible when considering the harmful and confusing message they send to pregnant patients, including those who may need to rely on this beneficial medicine during pregnancy. And the confusing message, like, that is what is so troubling about it, because now there is this mass confusion, and now we have to backpedal and produce this scientific data that no one ever probably really thought much about. Now we have to like really put it on the forefront and give the explanations of why it is not causing autism and why scientific research for the past 20 years has been focused on finding safe drugs for women during pregnancy.
And it's confusing. It's not an easy thing to explain because there are obviously so many limitations to how we can obtain data in pregnancy. And there's ethical considerations when we're talking about, for example, even pain. You're not supposed to say that it's okay to be in pain. In any other scenario, if someone is not pregnant, we don't ever say it's okay for you to be in pain. And so here we have the one medication that has not been shown to cause, that has been considered to be safe. And then there's all the factors of how we get this information, and patient reporting their intake and at what times, and then what is the actual end result, this vague, broad neurodevelopmental problems. And so let's just talk about why the data that they have is not good and what this new study, I think this is the best argument against all of these other studies. And do you know about it, the Swedish study?
No.
Basically, if you look at what data they used to formulate this statement, it's all old stuff. Like, it's nothing new. There's always been a few studies which find a slight association. It's never what he said, this very high association. Because if you think about it, I think something like 2/3 of women take Tylenol at some point during their pregnancy. Of all those tens of women who take Tylenol.
And the trimesters, it's not like, oh, it's safe in first trimester, not safe in second or third. It's been shown that it's safe through every trimester.
Right. And so there's a point on that, though, because they do say something about that the greatest association maybe in the women who took it for a long time at high doses. But here's where those confounders come in, because why is somebody taking it for so long at high doses? What is their underlying condition that they are taking this Tylenol for? And how much more likely is it that it's their underlying condition that is creating risks associated with these pregnancy outcomes versus the Tylenol itself?
Yeah.
So it's complicated. This one from 2024, so recent, actually, they looked at 2.5 million children over 20 years. And in Sweden, they have universal health care. So they were able to they didn't go back and ask someone, did you take Tylenol 20 years ago? They actually have like the midwives documented asking the questions, what medications are you taking? And they have that data. And it's from the entire population. Again, universal health care. So that's, pretty good data. And then they looked at the association between Tylenol and autism, and they found, yes, there was an association, which is not the same as cause and effect. The other thing about autism, just to sidetrack, aside from that it in and of itself is a spectrum, the factors that we believe to cause it are largely genetic with some environment. It's multifactorial, but genetics being a huge part of it. So they saw the same association that other studies have seen, but then they did a sibling study. So they said, okay, same mom, in one pregnancy, she took Tylenol, in one pregnancy, she did not. When they did that, the association completely went away, like 100% went away. So the risks were the same within the family, whether or not they were exposed to Tylenol in the pregnancy. So
that's so interesting.
Yeah, so that's the best data that we have. None of the data is perfect, but the size of the study and the sibling-matched controls, and apparently there's one that's either just came out a couple of weeks ago, I haven't had a chance to look at it, from Japan that did the same thing with siblings, found the same thing. So once you take out the confounders of the genetics of the family, then all of those associations disappear. So it's pretty good data. Like, I think as scientists or doctors, we don't speak in black and whites because that's not life. And when you're trying to identify misinformation, I think when you see people speak in black and whites, that's when you really have to, that's a red flag because that's just not the way the world is. So we have very good data.
Like, first of all, can I say, I think that's such a powerful statement that you just said. It's just so interesting. Like, life is not black and white. So, like, neither is anything that we talk about going to be in black and white. There's so many variations and factors that play into so much of our life. And I never really thought about it that way, Jen. That was a very
Thank you.
I love that statement.
Because yes, Tylenol, yes, you can overdose on Tylenol. Yes, you need to dose it properly. Even outside of pregnancy, if you just take too much, there's effects on the liver, et cetera, et cetera. But as a mild pain reliever, taken as needed, as a medication for fever, it's basically overall safe. And we're taking this safe medication and villainizing it. And that's another thing. It's when you see people really like villainize something. It reminded me of C-sections. Because it's the people who are just, C-sections are the worst thing, you know, et cetera, et cetera. And then it's putting on the shame and guilt. And then when someone ends up having to have a C-section who didn't want a C-section, and they're feeling all of that shame and guilt.
Because they're looking at the world in black and white and not all the gray of why someone might have a C-section.
And like, good for you if you didn't have chronic horrible back pain or kidney stones or have to have surgery during your pregnancy, or you didn't get a horrible infection that the only thing that you could take to make yourself feel better at all was Tylenol. If you didn't experience any of that and you didn't need Tylenol, like, okay, great, don't take Tylenol. But don't put on unnecessarily guilt and shame on women who did need that Tylenol for whatever reason.
Personal story.
Yes.
Did you take Tylenol during your pregnancies?
Yeah.
Same.
I don't like remember how much or when, but that
Well,
was...
I know we both had sciatica issues.
Yes. Mine didn't really get worse during pregnancy, though.
Mine was bad. I also had to have a dental procedure during my second pregnancy with Sawyer. I was just like very new into my second trimester and ended up having to go to the emergency room because I was in such immense pain. And they had to give me morphine in the hospital because I was starting to have contractions because my stress and my pain level was so high. Mm-hmm. And then after that, I took Tylenol to manage the discomfort in that like first week afterwards. And I did not think once that I was doing something harmful to my baby. And actually, I thought the complete opposite. I knew what I was doing was sustaining this pregnancy by not having my pain at such a high level that it was going to cause contractions at, I don't know, maybe I was 18 weeks, something, you know, like it was a very new pregnancy.
Did you have an infection as well?
I don't recall if I had.
Did you have antibiotics?
I don't think I was on antibiotics. I think it was just managing the pain aspect of what I was dealing with.
Yeah, so that's the other big issue is that not only is fever an infection potentially associated with autism, but it can be associated with other adverse pregnancy outcomes. And potentially, we don't know, we're not sure, but it might help, right? So if you're reducing fever, if that is the cause of things, if you think about it, we're not allowed to go in hot tubs in early pregnancy, right? So it might actually help. We don't know that. But to take something that might actually help by reducing the pain and the fever, which are also associated with these neurodevelopmental disorders, then it makes no sense to go after it as something that could potentially be causing it. And then you also think of, okay, so we talked about genetics, and what about advanced age or something like that, maybe more likely to have the back pain, or people who are just in generally sicker? Is it the sickness that leads you to need to take Tylenol versus it being the medication itself? And so the best data that we have when we look at these sibling studies is pretty good. I mean, it's not perfect, but that's pretty good to make you feel like if we're looking at sibling paired studies, and if they do more of these where they can over and over and over again, we're showing that when you look at siblings who the mom had Tylenol during the pregnancy and one didn't, and the association completely goes away, I think that's as good as you're going to get. And honestly, there's a lot more stuff that we could be focusing on right now on fixing and helping women and children if that's the goal of all of this. But we know it's not.
Right.
There are 1 million other things that we could be spending our time and energy on than this.
Yeah.
But this is where we are. And I want to, how do I say this? I understand the fear. I mean, when it comes to vaccines, I vaccinated my children. I believe in vaccines. And it's hard when you hear this stuff. And I followed the schedule that was determined for a reason, right? Mm-hmm. I'm not going to make it up. And it's so hard because even as someone I feel very comfortable with what I know. I feel very comfortable with knowing where to find my information, how to interpret the information if I'm getting it on my own. And still, you get this nagging thing in the back of your mind when you hear this stuff that just brings extra fear. So I'm not going to stop. There's nothing that's making me stop making the decisions that I think are right for my children. But having that extra thing in the back of your mind, I get it. It's so, as a mother, you can't unhear it. Yeah. And that's why it's so unfair.
Right.
Because that's all it's doing is adding this extra layer of guilt and second guessing yourself and things that even if you really know, you believe it and you know it because you trust the person who told you, or you believe it because you have your own knowledge of the subject. And still, that's why they're doing it, I think. It's because they know that this is a really easy way to cause confusion and fear.
And we're a really easy target because we are affected so deeply by thinking that we have a responsibility to care for our children. And if there is something that we have done to interfere with that, I mean, you're not going to find a mother who isn't going to feel incredible guilt. Also, too, I think what's so concerning about what he came out and said and how he said it as well is like, think of those families that do have autistic children and think of like how I can't even imagine like the replaying of my pregnancy that I would have started going down and how harmful that is, you know? And instead of healing and working towards having programs to support women and mothers and babies, we're now making these people feel like that they have a responsibility in something that was not their fault. And I think that's what's so upsetting about it.
And my understanding is that from what I know of the autistic community is that they're not happy about this. They don't believe this.
No.
They understand the genetic components. They also oftentimes, you know, like I said before, are talking about they don't like this idea that this is a terrible thing that we have to get rid of that's affecting our society, when some people with autistic children are like, my child is different and it's not necessarily something they would even change about them. Again, this is a spectrum, but on some ends of the spectrum, it's not even something they would want to change about their child. And what they need is support. And I think this extends to a lot of children with different types, the way that they learn or the way that they are. You know, it's not helpful. Like no one is happy about this, to my knowledge, in that community. Not just for maybe the guilt that they are feeling or not feeling, depending on how much they believe about this. The point is, a lot of women take Tylenol and their children are not autistic. And then a lot of women don't take Tylenol and their children are autistic, right? So there's people who are saying, well, I didn't even take Tylenol. You know, how is this helpful? How is this helping my child who needs resources, who needs new ideas on how to treat this? And there's never going to be a single approach to curing, quote unquote, autism. You know, it's ridiculous, I feel like, to even say like curing something that's a spectrum. But that's what some people, it seems like they're going after this, like, oh, we're going to fix it. And it's going to be a combination of therapies and interventions that help these children, and work on that.
Right.
Work on that. Like something that's really actually going to help. And that autism is not going to go away.
Right.
Ever. And many people don't want it to go away ever. Yeah. So it's just a really easy way to create chaos and to stoke fear. And when you start saying, well, I can't believe the experts, whatever it is that you're talking about, that is like the downfall of society. When we're saying like, we can't believe our doctors, believe this someone else, like this lawyer or this whatever. Where does society go when you can't trust experts anymore?
Right. I was just going to say, it almost, when we recorded a couple of weeks ago and you said something, we didn't even know this information was going to come out and someone was going to say this. And you're like, that's what makes being a doctor so hard right now, is that people challenge you in a way that is like, but I'm the expert. If you can Google anything, sure. And you can create that what Google is telling you is correct. But I'm your doctor looking at you and giving you this information. And to your point, like, it's a breakdown in our system if we no longer are respecting the experts in each field, whatever it may be.
Then how do you trust anything? And then truth and it's like it goes down this
it's a slippery slope
path. Yes. And okay, I want to a couple facts that I wanted to bring up because so for treating fever, we have basically Tylenol and NSAIDs, and for pain, right? There's also opioids.
Right.
I just want to talk about NSAIDs briefly.
Okay.
So that's like your ibuprofen, your Advil, your Motrin. Aspirin's also technically an NSAID.
Mm-hmm.
And we know that that is given during pregnancy after the first trimester to help with prevention of preeclampsia.
I also took it.
After
I
12
had a
weeks.
baby aspirin.
You took it after 12 weeks, right?
Yeah.
Yeah. So in the first trimester, there is potentially an increased risk of miscarriage, which is not seen with Tylenol. So they say, okay, we see this potential increase in risk with NSAIDs and not with Tylenol. So choose Tylenol.
Right.
Right? Now, there are, like everything, there are reasons that you may need to take an NSAID during the first trimester. And that is based on your own discussion with your doctor. What is your condition? Some people with these rheumatologic conditions that just literally rely on being on NSAIDs. And that doesn't necessarily mean that they're going to have a miscarriage every single time if they have to take this, right? That's the thing. We're saying increased risk. We're not saying that you're for sure going to have a miscarriage if you take it. Mm-hmm. It's when we have two choices, we choose the one that doesn't potentially increase the risk of miscarriage, right? Mm-hmm. And then in the third trimester, the risks with NSAIDs have to do with the kidney function, affecting kidney function and potentially causing oligohydramnios. So the kidneys are involved with creating amniotic fluid, so having low amniotic fluid, and also premature closure of the ductus arteriosus. So that is something that is part of our, let's just say, heart system vasculature, right? It closes after birth, and you don't want it to close before birth. And if it doesn't close after birth, you give a medication to close it, which is an NSAID. Mm-hmm. So potentially if you take an NSAID while you're still pregnant, you could have a premature closure of that blood vessel. That is important for fetal circulation, and you don't need it once you're breathing air and not in mom anymore. Okay, so those are like obvious things that we know. And again, like, doesn't mean it's going to happen, but it means that there's increased risk of these things. And so if you need to take that NSAID type medication, that's when you would have a discussion and a risk benefit analysis to decide if the risks of something else for untreated, whatever it is that you're using this, are higher than treating it, because everything has a risk, including non-treatment also has a risk. And then opioids, I feel like we don't really need to discuss this, right?
No. Well, one thing I do want to bring up is something he also did not clarify is there's Tylenol that's over the counter, and then there's prescription strength Tylenol that usually will have an opioid component in it.
Well, I wouldn't call that prescription strength Tylenol. I would call that an opioid.
Okay.
With Tylenol.
Okay. All right. But still, to
like a Percocet?
Right. But to separate the two, like there is...
It's not over the counter. Yeah, Tylenol is over the counter.
Correct.
In the United States and Canada. It's not actually in the UK, I don't think.
No, that's interesting.
But autism rates are high everywhere. I don't have this exact data, so I won't speak to it, but I want to say Australia, where the rates are the highest. They're high everywhere. They're rising everywhere. Part of that, this is a whole different conversation. But the only reason I say that is a lot of times people have this false idea that things are very different in the United States than elsewhere. And a lot of times we tend to, when it fits the narrative, we like to say, well, in Europe. And when it doesn't fit the narrative, we don't say that. Right. But so opioids, obviously, they have risks, inherent risks, whether or not you're pregnant. And with pregnancy, depending on how long and why are you taking it? Did you get in a car accident or did you, whatever you took your one dose of morphine when you had to. Risks of birth defects, potentially cardiac birth defects, and neonatal withdrawal syndrome is the main thing that we worry about with prolonged use of opioids during pregnancy. So those are all we know this, right? And I also wanted to bring up the word teratogen. Do you know what that is?
No.
Teratogen. So teratogenicity is any significant postnatal change in function or form in an offspring after prenatal treatment, and a teratogen would be the substance. So that acts to irreversibly alter growth, structure, function of the developing embryo. So when we talk about medications in pregnancy, we're trying to identify, is this medication a teratogen or not? You've heard of thalidomide. That's the classic example. Do you know what that is?
No, you gotta refresh
so this
me,
is
Jen.
From before our time. I don't know, was it the 80s maybe?
Okay.
Thalidomide, what did thalidomide even treat? But women were having babies without limbs.
Okay.
You don't remember this?
Yes, I remember this. Are we talking about an oral medication?
In the 1960s, it was prescribed as a morning sickness remedy. And in the studies, on the rodent studies, it didn't cause this problem. So ideally, something that causes a severe birth defect could be identified in the preclinical studies, so when they do animal studies. But sometimes, which is also important when we're looking at animal studies for other things, it's species dependent.
Right.
And so something that doesn't cause an issue in a rat can cause an issue in a human and vice versa. And in this case, it was not identified. Now, this is a long time ago. But a lot of women, the babies were born with very short or no missing limbs completely. So that is an example of a teratogen. So 100%, you cannot take this during pregnancy. Another example, Accutane, taking it for acne. And that is known to cause severe birth defects. And in fact, when you're prescribed Accutane, they need to make sure that you are on birth control pills as well, right? So those are examples of things that are very clear. And then when you look up acetaminophen, that is not a known teratogen. So this is how we look at safety. And then, so the FDA used to classify medications, do you remember, as A, B, C,
I know.
D,
I
X?
actually didn't realize in 2015 that they changed the classification for prescription drugs to be pregnancy, lactation.
Yes. They basically just said it's too complicated. So now they have to give you just a whole explanation. They don't say, because there are those ones that are really clear cut, the thalidomides of the world.
Right.
And then there are so many that has a potential risk, but there are scenarios when you need to use it. And so we can't just say you can't use it. And then there's ones where like the risks are very, very small.
Right.
Tylenol. And so we're not going to use we're going to use that different language. And so it's a language thing now instead of classifying it because it's too complicated. And the studies are difficult to get and they're difficult to interpret. And it requires many studies, proper interpretation of the studies, reducing the confounders. And for example, like the best way to study this would be, I don't know, make everyone take a Tylenol every single day and then someone else takes a placebo pill every single day,
and we do the comparison.
And then you do a comparison, which they're taking them for a reason. Like that's the thing. And so
I
then
think
what
that's one of the most important factors of this whole conversation is that when you utilize a drug properly, when you're using it to mitigate discomfort or pain or a headache or a fever, anything like that, that is the goal. That is what medicine is there for. And I think that this confusion that has now come in, it's like, you're just questioning, like, personally, it's like now I question every drug. If you're going to like go out there and say one thing about one drug, it's like, okay, should we all just start questioning everything?
Yes, but we don't take drugs for no reason.
Right. Like, no, that's what I'm saying. Like the point of taking a medication is to solve
you're
a
sick
problem. Yes.
Or you're ill or something is going on.
Right.
Otherwise, yes, great. Don't take anything during pregnancy. Absolutely, that's the goal, but that's just not the reality for so many people. I want to just make one comparison because it's just been on my mind, and that's about C-sections and epidurals.
Okay.
And this is what my brain does. I just start thinking on it, and I'm like, okay, this is like how I very confidently will say that epidurals don't cause C-sections. And I often have to reread why I say that, just to be really up to date on why this has been the consensus in the community. There's enough studies that similar to this Tylenol one with the sibling control studies that make me feel comfortable saying that. But there is never going to be a perfect study where we say, you can have an epidural. Everyone has to get a needle poked in their back, by the way, because it has to be blinded. We can't do that. We can't blind an epidural anyway. And then you can't withhold treatment from somebody who wants one. So suddenly they say, actually, I want an epidural. And then you can't force an epidural on someone who doesn't want one. It's just confusing. Plus, there's so many reasons people have C-sections. It's so multifactorial again, right? Like, who's your provider? And everything that's about you in your pregnancy that have a much stronger link with C-sections. And then also the procedure itself is not universal. So there is not one, this is what an epidural is. There's different techniques, there's different dosages, there's different maintenance infusions, different ways that we initiate it. There's just never going to be a perfect answer. However, are epidurals associated with C-sections?
Yes.
1 million, right?
Yeah.
Of course.
Yes.
Yes,
Yes.
absolutely, right? Because, and you can just imagine why. Because, first of all, I recommend, if you've had a prior C-section, you're going for a VBAC, you're at higher risk for C-section for that reason. You should have an epidural in place so that we can activate it quickly if you need to go to the OR. If you're high risk for any other reason, let's say you have a twin pregnancy, whatever it is, you may be recommended to actually get an epidural for that reason. And then what about someone who's in labor for a very, very long time, who gets exhausted and requests an epidural versus somebody who comes in with a precipitous labor and has their baby, even if they maybe wanted an epidural, they didn't get one. And so obviously the association is there, right? If inductions, whatever, size of the baby, there's just so many things that might cause, they talk about labor pain, and is it possible that the pain itself, when you have a more painful labor, you're more likely to end up with a C-section versus not. And of course, if you're having a more painful labor. So all these things, it's so complicated.
I was just to say, even just you going through the list, I could think of like a bunch of other things. Like, it is so complicated. You can't just make a blanket statement like that to say, if you have an epidural, you're more likely to have a C-section.
Right. Even
without thinking about all
the other factors that led you to make that decision.
Yeah.
And also the people that choose it. What is it about the people that choose it? Whatever. It's just very complicated. So one of the goods, they did do some randomized controlled trials. The problem is that they couldn't compare epidural to no pain relief.
Okay.
They had to have another option for pain relief if the person wanted it. So instead they did epidural versus opioid, usually meperidine. So like a dose of an IV pain medication.
Okay.
Those did not show an increased risk of C-section when you compare epidural. So you're not comparing it to the person at the birth center who's not having any medication, but that's the best you could do. But the other thing is, I think this is makes a lot of just intuitive sense to me. So if epidurals in and of itself increase your risk of C-section, then you can assess before and after a sentinel event. So they're in Hawaii in 1999. They put out a study. There was at the Tripler Army Medical Center. In 1993, they had an epidural rate of less than 1% because they just didn't have like the staffing available, or for whatever reason, less than 1%. And then the very next year, the government said you actually have to have an epidural available for patients who want it. It went from less than 1%. And they also looked at first-time moms in order to like not make it complicated, right? Okay. Who obviously had not breech babies and were otherwise a candidate for vaginal delivery. First-time moms, less than 1% to 80%.
Wow.
80% epidural rate in 1 year.
Wow.
So you would think, well, then what happened to the C-section rate?
Right.
It stayed exactly the same. So there's a bunch of studies like that. That's pretty good, right?
Yes.
So you have to, and like none of these are perfect, but you have to look at all of this data. And so then you can say about Tylenol, oh, it wasn't even invented when the first autism diagnosis, stuff like that. And then the other really good one to think about, if it just helps you feel better, is the autism rate continues to go up and the use of Tylenol goes down. Well, there's a lot of different ways to think about it. And in general, the recommendations didn't really change, even though it was this big announcement. Take the lowest dose for the shortest periods of time. Only take if you need it. That was already the recommendation.
Right.
That remains the same. All we did was add this fear factor to make everyone
question everything,
anxious and guilty than we already feel, because that's, So anyway, I hope that's helpful for anyone who hasn't heard some pieces of this discussion.
For sure. I think we just all got a tour of your brain. And your thought process. We went on a
maze in there.
It's much appreciated. I feel like we need to wrap up with a little breathing exercise after all that information.
Please.
And even more important, because what we work so hard on, and what doctors and nurses and all people in the medical field, is to support patients in the best way. And misinformation is so dangerous. We know that. When we talk about C-sections, you could talk about so many different medical conditions that misinformation is not right. And focusing on factual information, scientific data, going into Jen's brain and getting a full explanation of all of it.
Oh my gosh.
Very appreciative. Okay, so actually, I love this exercise. I actually meant to talk about it for dad diaries because I think it's a good one for dads as well. A dad actually was teaching this on an Instagram post.
Oh.
So you're going to just take a deep inhale through your nose, Jen, as much as you can. And even when you think you've taken enough, take one more extra and then let it all out in one go.
I like that one.
Do you like that one? Right? Like, do it again. It's like you inhale and you feel like you can't inhale anymore.
How long do we inhale in first?
For as long as, well, everybody's a little bit different.
But then when do you add more?
When you feel like you've reached your point of inhaling, just go just that little bit more. And now release it all. Feel better?
Yeah.
Oh, good. Thanks for joining us.
Thank you for joining us. I'm so sorry that this world is so confusing.
I know.
And
we're here to try to make it a little bit better.
We want to make you feel better.
Yeah.
We want to give you the knowledge. We care about you. We want what's best for you. And we understand that as moms, we want what's best for our children. And it's so terrible when those things feel conflicting, and it just adds to all of the guilt that moms, it's already laid too much on moms.
It's already hard being a mom.
Let us go. Like, please tell us something that dads are doing wrong. Like, please, can we focus on something something with men, please? Like, find something.
I'm going to find something.
What did the guys do wrong? Like,
I don't know.
All right. The usual, follow us on Instagram, The C-Section Experience. Download our free C-Section guide. We still have that up.
Yes.
And email us hi@csxpodcast.com. Watch us on YouTube if you are not already. And we will see you next week.
Bye.
We had so much fun recording this episode, and we hope you enjoyed it. Please reach out to us and let us know what you think and what you would like to hear about in future episodes. We would love to hear from you. You can email us at thecsxpodcast@gmail.com or follow us on Instagram at thecsxpodcast. We'll be back with more next week. Bye.